Hi, friend. Are you ready to unlock the secrets to vibrant health? My guest this week is Dr. Michael Klaper. We dive into his groundbreaking insights on how a plant based diet can revolutionize your well being and challenge the norms of modern medicine. Discover the powerful stories and science behind his mission to put food at the heart of healthcare. So, whether you're curious about nutrition or you're ready to transform your life, this episode is your gateway to a healthier future. This episode is brought to you by Grand Teton Ancient Grains. They're an organic family farm and on site mill producing high quality grains without pesticides, herbicides, or glyphosate, just real food grown and milled with care. I absolutely adore their products. They offer ancient grains like einkorn, emmer, millet, and rye, plus fresh flours and traditional pastas. Their stone milled bronze dye pasta has incredible texture. It actually holds on to your sauce. Learn more at ancientgrains.com and you get free shipping when you fill a box. Details are in the show notes. And now, here's Dr. Michael Klaper. I'm Lauren Bernick, helping you make the rest of your life the best of your life. Welcome to Age Like a Badass Mother. Dr. Michael Klaper is a pioneering physician with over 40 years of clinical experience, known for his work in using nutrition to prevent and reverse chronic disease. His new book, Moving Medicine Forward, challenges the medical status quo and makes a powerful case for why food should be at the center of modern healthcare. You can find out more about him and his book at movingmedforward.org. Please welcome Dr. Michael Klaper.
Hi,
Hello,
Klaper.
welcome.
Hi,
Good
great
to,
to be with you and your viewers. Thanks for the invitation.
of course. And just in case my viewers or listeners don't know, I've actually interviewed you before. You're on episode 3. So if they want to go and listen to, how you came into lifestyle medicine, and I think we talked a lot about, the benefits of soy and protein and blah, blah, all that kind of stuff. Just go to that one because we're going to try and cover some different ground today. So first, I just want to start off by asking you some fun questions because I feel like you're making the rounds a lot with your new book and maybe a lot of people know some about you. But let's start with some questions like, what's your favorite movie?
Oh my, I'm a big film fan. In recent years, it's gotten all taken over with action films and violence, but there's some thought-provoking films. The one I saw lately is called the AI Doc, and I highly recommend it. It's a very informative documentary on the realities of AI produced by the people making the AI and their
Oh,
concerns.
wow.
So I
Yeah,
highly recommend that one. It's a good one.
that's good. I mean, where can you watch that? Just regular
Oh,
streaming
it's in the
platforms?
films. It's in the theaters, but I'm sure it's going to be on Netflix. If you look for
Oh,
it,
okay.
you'll find
It's
it. They
still in
want
the,
it out generally. So seek and you shall find.
okay. Okay. Do you have a favorite song?
Oh my. Um, I'm a classical musician fan, and when I walking through the forest and hum to myself, it's often the theme from Beethoven's Ninth, and um, some Schubert melodies are really nice as well. But I hum the classical themes to myself. I really find
Oh,
them comfortable.
wow.
Mhm.
Wow, wow. And so do you play a musical instrument?
I used to play the clarinet and the piano, so but hopeless amateur when it comes to now. I'm a fan rather than a performer for sure.
Okay. So do you have like instruments at home or
I
have you
do.
stopped to
Yes,
play? You
we
do?
got a piano and I've got a small keyboard and my clarinet.
Oh, so you do still play.
But when I have the time, I feel it's stolen time. I feel guilty. I've got so much to do. I got a to-do list down my arm here. But
I bet.
especially when my wife is out shopping, I'll play the clarinet.
Oh, that's so funny.
Yeah.
My husband used to play the clarinet. I think when he was in middle school, that was his instrument too. Yeah.
Uh,
Oh gosh. Do you have like a hobby? I mean, or is that your hobby?
When I was in college and when I was an undergrad, I minored in astronomy. And I loved the nighttime sky. It was just so beautiful and truthful and stunningly humbling. And now it's getting really exciting with the satellites and the space travelers they're putting up there. So it's fascinating to get even a better view, say, of the moon like we got last week. But I really enjoy astronomy, and I'm an avid birder. I love watching the birds. Distressed as their numbers are disappearing, but I'm a big fan of the birds, and so between the birds and
Oh,
the stars, keeps me busy when
keeps
I
you
have.
looking up.
It keeps me looking up. Very good.
That's right. I guess that's why I've heard you talk about Galileo before, because you are.
Mhm.
That's interesting. Okay,
Mhm.
what have you said about Galileo for people who don't know?
Well, I commensurate with him. I'm certainly not on his intellectual level, but the story goes that he invented the telescope. Well, he modified it. It was invented by other people, but he constructed his own telescope and turned it on the planet Jupiter one night in 1607, and saw something that changed his life, changed all our lives. Back then, the dogma was that the Earth was the center of the universe and everything revolved around the Earth, and and the Catholic Church had a great investment in that view because if they're the greatest power on the earth, then they're the greatest power in the whole universe, etc. So they wanted to keep that dogma the way it was. But here's Galileo. He turns his telescope on Jupiter one night, and he sees the planet and going around Jupiter are these four pearl-like moons, the moons of Jupiter, Io, Europa, Ganymede, and Callisto, and they're beautiful to watch. You can see them move through the telescope. But he realized, good heavens, we are not the center of the universe. Here's four objects not going around the Earth; they're going around Jupiter. We are not the center of the universe. So he runs down to the court where the wise men and the scholars and the priests and the doge were all there, and he sets up his telescope and says, "Look, we're not the center of the universe." And and he expected this response of great revelation. What response did he get? Oh, they refuse to look through the telescope. Oh, they don't want to see that because that blows their whole power game, and refusing to look through the telescope has become a clinical chestnut in science that people don't want to see the truth. Well, here we are, as witness my book and my work, where we're trying to get medical schools and doctors to see that the cause why their patients are sitting in front of them with bodies that are overweight, hypertensive, atherosclerotic, diabetic, and from what they're eating, it's the food your patients are eating. Oh, they don't want to see that. They have no training in it. It threatens their financial model. And on some level, I can empathize with Galileo, what he felt like, what he ran into. I've got a similar obstacle to overcome here. So yes, I'm a big Galileo fan, and my heart goes out to him, and I take inspiration from him.
Yeah, I mean, that really is the heart of, what we're going to talk about today. That's exactly it. I want to do a little bit of background before we get into that. For those who, I mean, I feel like a lot of people know this information, but for those who don't, um, let's just start with a little bit of background. First of all, I know that you worked at the Cook County ER.
Hmm.
How did that affect you?
Hmm. Well, it was kind of a three-way bank shot. I'll tell you the story in that Uh, I was a fourth year medical student at the University of Illinois in Chicago. And during that fourth year, instead of trying to date the pretty girls over here, the stewardesses that would come in on the international airports, I would spend my Saturday nights in the trauma unit at Cook County Hospital. And I would see the worst of what humanity does to each other, the shotgun blast and the blunt club assaults and the stab wounds and the 38 Saturday night special pistols. And I would walk out of that trauma unit Sunday morning shaking from what I had seen. And I saw the effect of violence, and it made such an impression on me. I decided if I can't rid the world of violence, at least I can get the violence out of my own life. And so I made a point of studying the philosophy called ahimsa, a Sanskrit word for nonviolence, and you can live a life with that as a guiding principle. And I took it seriously, and I started reading the books of the Indian saints and Mahatma Gandhi about living a life of nonviolence. I thought I had that one down till I became an anesthesia resident in Vancouver. And one night I'm out for dinner with a fellow resident, and I'm pontificating about living a life of nonviolence while I'm polishing off a porterhouse steak at the local keg and cleaver. And my friend looks at me and says, "That's all very nice, Michael, but if you want to get rid of the violence in your life, you might want to start with that piece of meat on your plate, because in satisfying your desire for the taste of flesh in your mouth, which is really what this is about, you are paying for the death of the animal and for the next one in line at the slaughterhouse." Well, I love animals. I spent my summers on a dairy farm caring for the cows and the chickens. I don't want to be paying for their death. And when he said those words, all the old rationalization sprang into my mind. Well, that's what they raised them for, and the animal's dead already. But before I could get those words out of my lips, the little voice in my ear said, he's right. He's right. And when I went up to pay for the steak dinner, I felt complicit in a crime because I'm paying for the death of these animals. Well, after that, that was the end of my meat eating, and dairy followed shortly after that. And so I adopted a plant-based diet. I was also seeing in the operating room what the standard meat-based diet does to people's arteries, and my dad died of clogged arteries. I know I've got those genes. So between what I was seeing in the operating room with the clogged arteries from the standard diet and what I knew in my heart from that night in the restaurant, that was the end of my meat eating. Well, my body loved it. Within 12 weeks, a 20-pound spare tire of fat melted off my waist. My high cholesterol went to normal. My high blood pressure went to normal. I felt great waking up in a nice, lean body every day. And at that point, you can't unring the bell. Once you see it, then I realized why my patients in general practice were all getting more obese and diabetic from what they're eating. And so at that point, I didn't want to be an anesthesiologist anymore. I wanted to go back to general practice and help people wake up. So that was a major, my time in the trauma unit in Cook County made me, introduced me to the role of nonviolence, and that in turn got me onto plant-based nutrition. And I became a plant-based doctor after that, and then become the happiest doctor I know because my patients get healthy now. So three-way bank shot from thank you, trauma unit at Cook County. It really helped me along my way.
Oh man, I can't even imagine what that must have been like. It's funny because I try not to post a lot of graphic things about animals because so many of those things come across my social media feed and it haunts me. And, I already don't eat them, so I don't want to look at it anymore because I already know. But my friend said to me yesterday, "Oh my God, have you seen this video?" And it was disturbing, about what they do to the animals in the slaughterhouse. And I was like, "I haven't seen this particular one. I have seen so many." And she said, and I've talked to this person before about not eating animals because she always says she's an animal lover. And she said, "Well, this is really getting me thinking now about not eating animals." And I'm like, "Oh my gosh, well, maybe I really should be posting that kind of stuff." But I don't know. What do you think about that? What are your thoughts? I mean, people do risk their freedom to get these videos because it's illegal to show what goes on in a slaughterhouse. Because if we saw it, they'd be losing customers. I mean,
Indeed, well, I'm sure you know Paul McCartney's famous statements that if
yes,
slaughterhouses had glass walls, we'd all be vegetarians. I mean, if
right.
people really saw about what it takes to turn those beautiful, innocent animals into that piece of flesh on their plate, they would have the same reaction. So
Yeah.
how do I feel about those videos? They have a role. The truth is the truth. they're most valuable for people who are totally new to the idea. And if it helps, if it shocks people, good. And if it helps them move along to a plant-based diet, I've never heard a carrot scream. I've heard a calf scream. I've heard a cow scream. Never heard a piece of broccoli scream there. If they want to get the violence out of their life, then those videos have a purpose. If you're already vegan, if you've already been through that, you read the books, seen the videos, there's no reason to put that in front of your eyes again. And so they're kind of the entrance fee that
Yeah.
people embarking on their plant-based journey kind of have to pay, unless they're just focused on their waistline and their cholesterol. Okay, fair enough. Whatever it takes. He said there's three doors, if you will, that people come through to adopt a plant-based diet. One is their health. It's the definitive treatment for obesity, diabetes, high blood pressure. It reverses these conditions. But it also is there are people who just don't want to eat the animals for what it inflicts upon them, and finally the folks who care about the planet. When it dawns on them, when the word gets out that the growing all this animal flesh is why we're cutting down the forest, why we're sucking the rivers dry, why the soils are eroding from growing all this animal flesh. So they say, I don't want to contribute to the degradation of the planet. They all roads lead to Rome. All those doorways lead to a plant-based diet. Fine with me. As they say, the cow doesn't care why you don't eat her.
Right.
She
Yeah.
just do it, just get on with
Yeah.
it. You down plant-based
Yeah.
diet. So they have a role, but if you're already there, you don't need to stir up your night's sleep thinking about new images of
I
that
mean,
horror.
yeah, it's terrifying. And so, yeah, it just got me thinking, like, oh, this is what it takes. Like, maybe I do need to show one every once in a while, you know?
Indeed, they have a
All right.
use. Hmm.
Yeah. Yeah. Okay. So, can you explain what happens inside of our bodies when we ingest something like a cheeseburger and fries in a milkshake versus what happens to our bodies when we eat a bowl of brown rice and beans and kale and tofu and veggies?
Oh my. That is such a profound question, and the answer is large and complex. I'll try and bring it
Yeah,
down
it's a big question.
in
Sorry.
terms. But it is so profound when one changes their daily food stream from one based on animal flesh, so bacon and eggs for breakfast, and cheeseburger for lunch, and chicken for dinner, dairy, that's your basic food stream. And you then, for whatever reason, your own cholesterol, the animals, whatever reason, you change to a plant-based diet. The change you have created in your body from going from an animal-based food stream into a plant-based food stream is so profound that it changes the entire physiology of every system in the body. So let me quickly run through that. When you bite into that cheeseburger, yes, there's a piece of meat and cheese in there, so a whole bunch of saturated fat flows through your arteries. It makes you more obese. It fans inflammation. Causes disruption of many enzyme systems through the body, but also, along with the saturated fat and the cholesterol, and this is oxidized cholesterol. No one eats raw meat. So the very act of grilling the burger, broiling the steak, frying the chicken oxidizes the cholesterol in the animal's muscle. So when you're biting into that chicken flesh or the burger, you're getting the oxidized cholesterol, which is far more likely to cause plaques in the artery walls. So in comes saturated fat, in comes oxidized cholesterol, but also uh, the animals in the feedlot are fed bushels of grains that are sprayed with herbicides and pesticides, and they're given hormones and antibiotics as growth promoters. All these bioconcentrate in the animal's flesh. So when you bite into that burger or the chicken wing, you're getting all the concentrated toxins that the animal was fed during its lifetime. Plus, there's this issue now of microplastic. Well, first of all, you don't have to give antibiotics to broccoli. You don't, and when you
Right.
steam broccoli, you don't create oxidized cholesterol and free radicals, etc. So again, the plant kingdom offers a much safer kind of food. There's this issue of the microplastics that are concerned. The oceans are filled with everything from floating plastic bags to the fish nets that the commercial fishermen cut loose and that are made of polypropylene, polyethylene. Out in the tropical sun, the sun beats down, these plastic age, they break up in the storms to tiny little pieces of plastic that are taken up by the small fish, the sardines and the anchovies, eaten by the bigger fish, and the tuna and the salmon. So the people who eat the fish get these microplastics. They are showing up in our brains, our arteries, our heart. We don't know all that they do, but none of it is good. They release carcinogens, they stimulate blood clotting. So that's an issue if you eat fish. But the people who don't eat fish, oh, well, I'm safe, I don't eat fish. Not so fast, because it turns out that only half the commercial fish catch is sold to restaurants and supermarkets to be eaten as fish. Half the commercial fish catch is ground up and added to animal feed as a protein extender. So it's added to cattle feed and chicken feed and pig feed. And so that accumulates in those animals' flesh. So as you're biting the burger and the chicken, the microplastics are coming in. So that's in the meat. The cooking the animal's flesh, as I said, creates free radicals that rip electrons off your DNA, off your genes. Again, steaming broccoli doesn't create that. There's a whole list. If people want to see the effects of eating a meat-based diet, go to our website, movingmed.org. And there's a video there that I show it's a lecture I give to the medical students called "What I Wish I Learned in Medical School About Nutrition." And in this video, you'll see the entire list of what floods through your tissues with every meat-based meal. I call it the red tide. And it's salty and sugary and oxidizing and causes disruption of enzyme systems throughout the body. And it's one reason we wind up obese and diabetic and hypertensive and caught up from this toxic food stream. Well, when you shift to a plant-based diet, all those molecular marauders, they disappear. And now every salad, every bowl of vegetable soup, every plate of steamed greens floods your tissues with phytonutrients that promote tissue repair, with antioxidants that neutralize free radicals, that give the chemical message to your tissues of shh, calm down, everything's okay. And it's a high water content diet from all the soups and salads. So the blood is less viscous, it's more watery. So there's more free-flowing blood that surges through the capillary beds of your brain, your heart, your kidneys, bringing these nutrients to your tissues even more effectively. The magnesium and potassium in the plant foods works their way into the walls of the arteries, so the arteries dilate a little bit. That creates a tremendous increase in blood flow through the capillary beds throughout the body. On every level, the food stream is different. The hormone levels. The cows in the dairy are all pregnant now. They've genetically modified the dairy cows. So their milk they're sucking milk off large pregnant bovines. The milk's full of estrogens that give women breast lumps, give guys man boobs, give them prostate cancer. Well, those disappear. So weight loss becomes easier. The chances of developing these hormone-driven cancers go down. It heals tissues throughout the body. So that change in going from an animal-based food stream to a plant-based food stream is so profound. People need to take advantage of that, and the doctors need to know about that so they can feel confident in urging their patients to adopt this kind of diet. And it forces the doctors to learn a skill that I was never taught in medical school called de-prescribing. You got to get these patients off their medications because their high blood pressure comes down. If you keep them on those potent medicines, they'll stand up and pass out on you from low blood pressure. The patients were taking insulin for type 2 diabetes because their insulin receptors are all clogged up with the fat they're eating. Well, a whole food plant-based diet is naturally low in fat, so their insulin receptors open up on a plant-based diet. Their own insulin works fine, and if they keep injecting insulin, they will have dangerously low blood sugar. So you got to learn how to stop the insulin. There's an art to getting people off these medications. So, because they turn into normal, healthy people right before your eyes, it's the most exciting transformation in all of medicine, which I'm trying to communicate to my colleagues here. So,
Yeah.
I just thought, what changes when you go from an animal-based food stream to a plant-based food stream? Everything
Everything.
changes. It's a
Everything.
different physiology, and that allows for these wonderful health transformations that we see when people adopt that kind of diet.
I mean, yeah, and you talked about just you touched on diabetes that people think people always think that's a disease of like carbohydrates and sugar, and you just said it's a fat. It's fat clogging up your insulin receptors, right? I
Correct.
mean, it's
Absolutely.
yeah.
When people think diabetes, oh, sugar, bad carbs,
Hmm.
low carb diet. Well, when you go on a low carbohydrate diet, you got to get your calories somewhere. What takes its place? Fat. So it goes on a high fat diet. And as our vaunted Secretary of Health and Human Services was proud to declare, we've ended the war on saturated fats. Well, sure, you're going to find out the hard way
Yeah, you're gonna
that
see what
saturated
happens.
fats not only fan inflammation, but they clog up insulin receptors. You're going to see an epidemic of type 2 diabetes here. Uh, and uh, but as they say, but the glory of a plant-based diet, it's a reversible disease. Well, we're taught the opposite. Once on insulin, always on insulin. No one gets off. As I said, not only can you get them off insulin, you have to get them off. And but
Hmm.
the secret is to cut back on the fats in the diet. You need some fats, but get it out of olives and avocados and walnuts. Don't pour it out of glass bottles there. And and cutting back on the saturated fats open up the insulin receptors, and type 2 diabetes goes away. No one ever told me that in medical school. It's a reversible disease. I wish someone had told me that. But it's one of the many benefits you get from adopting a whole food plant-based diet.
Yeah,
The answer is not low carb, it's low fat to
right.
reverse type 2 diabetes.
Yeah, okay. I mean, I want to talk about your book and why you wrote it because it just seems like, well, it's like you said about Galileo. They're refusing to look through the telescope. Why? I mean, I know why. And also I read your book. But I know why. But like why? Why won't they look through it? And also, I think you brought up something really valid in the book. If we do go to teaching nutrition in medical school, what nutrition do we teach them? So, yeah, can you answer those two things? Why won't they look through the telescope, and then how would we decide what would get taught?
Oh, profound questions. Thank you. Well, two aspects there. Why don't doctors know anything about nutrition? You know, the haunting cry I hear from patients, why does my doctor know what to tell me to eat? There's layer upon layer of betrayal of our patients when it comes to medical school education. Nutrition is barely mentioned in all 4 years of medical school. And when you do get an hour lecture on nutrition, it's about scurvy or beriberi diseases you're never going to see. So it's not taught. But when I mention this to my doctor colleagues, they say, listen, not only do I not know anything about nutrition, I don't have time to do this counseling. I don't get paid to do this counseling. And so the the practice of medicine has become sclerotic, has become fibrosed, and we don't never ask about the patient's diet. They say, I don't know what to ask my patients, and if they told me, I wouldn't know what to do about it. So we never even ask about it, for one thing. Plus, it's a threatening message. The idea that the American diet is the driving force behind the obesity, diabetes, etc. It challenges the model of disease that most doctors say, oh, it's all genetic, it's all stress, or whatever. It challenges their model of disease. It challenges their practice model. In that, in my book, I'm advocating for the doctors who say, listen, I don't know anything about nutrition and I don't have time to do the counseling, my message to them is you don't have to know anything about doctors. There are plant-based dietitians now who will happily do that counseling for you. You need to find one and set up a referral relationship. So after you see your patients, say, I want you to contact Miss Jones. She's going to talk to you about what to eat. She's going to show you videos. You eat like she's telling you in her plant-based instructions. You come back and see me in a month. Let's see if you're not leaner and healthier. That's how medicine should be practiced in the 21st century. But that pulling the dietitian onto the primary care practice team, oh, they don't want to do that. And finally, of course, it challenges their financial model. If we stop doing so many coronary artery bypasses, there's going to be less money paid to the surgeons, etc. And they don't want their golden goose threatened anyway. So these are the big factors. In fact, there are other layers that one reason that the doctors aren't taught anything in medical school is that who's making up the curriculum? Certainly big pharma, who's making all these drugs to treat the symptoms of disease. They don't want that golden goose threatened anyway, and they're the ones who fund the research studies. And what studies are going to fund that show that their drug works, and so that's what the medical students are shown, and so they get what I call pharmacosclerosis setting in their brain. They think that drugs are the first thing to reach for when it comes to helping your patients. And then big ag, the meat and dairy industry, they give millions of dollars to the medical schools, and they shape up some of they have influence as far as what is taught. So all of the factors conspire to keep this panoply of ignorance in place there. So doctors go through 4 years of med school without any real basic knowledge of nutrition, how to use it to reverse these diseases. So this is the mountain that we got to climb with our Moving Medicine Forward initiative, but it's the mountain worth climbing. We can't let things stay as they are. We owe it to the patients. We owe it to the animals. We owe it to the planet. We owe it to the kids who are going to inherit this planet. On every level, it's got to change. Medicine's becoming unsustainable. It's such a wasteful system. People come in overweight and clogged up, and you do these bypasses, and they get infections, and they limp out of the hospital after generating a $500,000 bill worth of care to do what? To go head right to the fast food restaurant, start eating more cheeseburgers and more buffalo wings to clog up their grafts again. That was wasted money. That money could have been used to send kids to college, put internet in everybody's house, fix the roads, fix the bridges. That money could be used to benefit everyone instead of just keeping the cycle of disease going. So on every level, the system is unsustainable. It's got to change. And it's a matter of starting to teach the medical students about nutrition, which is why I'm going to the medical schools and giving the students this lecture on what I wish I learned in medical school about nutrition. So they come out as nutritionally aware doctors who know the power of a plant-based diet to reverse disease. Now this comes back to getting medical schools to teach nutrition and what will be taught. I was very pleased when Mr. Kennedy announced that he got 53 medical schools to agree to include 40 hours of nutrition as part of their standard medical school curricula, which is great. It sure beats the 1 hour or so that they're currently giving. So it initially sounds like good news. But the question is, what exactly are they going to be teaching?
Yeah, we saw his food pyramid, so.
Exactly. And the meat and the dairy guys have Mr. Kennedy's ear, and that's what's going to get prominence. And I don't want the students getting inculcated that you need a carnivore diet and a paleo diet, because that's packing your intestine full of meat 3 times a day. It's a recipe for an epidemic of colon cancer, of heart attacks, of strokes, of vascular dementia, of a leaky gut and autoimmune disease. That will be a diet of disaster. And finally, I gave a when we talk about a new vision of nutrition education, I gave a lecture in Seattle, and afterwards the professor of surgery comes down and says, "That's all very nice, doctor, but the uh, what core the curriculum that we pack into these medical students' heads during 4 years is so jam-packed with courses. What do we want us to take out of the curriculum to get in your nutrition course? You want us not to teach them pathology? You want them not to teach anatomy? What should we take out so you can get your nutrition course in?" But again, that's a misunderstanding of the process. I don't want them to take anything out. Nutrition is so fundamental to medicine and healing, it needs to be woven into every course during those 4 years of medical school. The first 2 years of medical school are basic sciences, anatomy, physiology. Well, nutrition should be in every one of those. The anatomy of the digestive system, the physiology of how the digestive system works, the biochemistry of how food is turned into energy, pathology, all those diseases have a nutritional origin there. So during the first 2 years, nutrition needs to be woven into the basic sciences. And then the last 2 years, as the medical student rotates through the various clinical specialties, you start with obstetrics, delivering babies. Well, nowadays the women are getting obese and developing type gestational diabetes. The kids are developing so big you got to do cesarean sections from what they're eating. There should be
Hmm.
nutrition rounds on every obstetric service. Move on to pediatrics. The kids are getting obese and diabetic. There should be nutrition rounds on every pediatric service in the hospital. Then you move on to internal medicine. Well, all those people there with the clogged arteries and the renal failure are there from what they are eating. There should be nutrition rounds on every internal medicine service. A surgery rotation. What are they doing in the operating room? They're taking out gallbladders and amputating legs from what their patients are eating. It should be woven into every aspect of medical education. They shouldn't have to remove anything, but that would produce a physician who came out knowing the importance of what their patients are eating. They would ask about it at every visit, and they would, every in chapter 7 of our book, it's called A Day in the Disease Reversal Clinic. And every doctor's office should be a disease reversal clinic. But to put that idea in the doctor's heads that, gee, I could reverse these diseases, that should be the awareness that every doctor should be graduating with. So that's the purpose of our book and our nonprofit initiative here of moving medicine forward. If people want to see what we're doing and help us, go to, as you mentioned, movingmedforward.org. But so this brings us back to Mr. Kennedy. So what are they going to be teaching in those medical school curricula? And our organization has taken it upon ourselves. We are going to be riding herd and watching over the shoulders of every one of those 53 medical schools. We want to see the curriculum that they are presenting, and we want to make sure that the science behind plant-based nutrition and its ability to reverse diseases are fully and honestly represented. I'm not saying that they can't show, though I defy them to show me studies showing that a carnivore diet reverses atherosclerotic plaques and lowers high blood pressure and reverses type 2 diabetes. I want them to present their studies showing that, but I just want the plant-based studies honestly represented there. So that's our next focus of activity of our nonprofit organization, and the book is a help in that campaign.
Yeah. And just so that people, we touched on this but didn't really say it outright, is that you're going to the medical students, and it's not even through school. You're reaching out to like clubs and things and really trying to reach the students with this information so that they request it, so that they ask for it, so that they know it and they graduate with that. I think that's an important point.
Yes, people say, well, how do you get into the medical schools? They don't want to hear this message. They're
Right.
right. The administration does not want to hear this message. As I said, it threatens every level of their intellectual and financial model. So we take advantage of the fact that this wonderful organization, the American College of Lifestyle Medicine, which promotes a plant-strong diet, has interest groups in most every teaching hospital, every medical school, and many community clinics. There are what are called lifestyle medicine interest groups, LMIGs, the LMIGs. And these are medical students, medical residents, surgical residents, attending physicians who understand the importance of lifestyle medicine, getting to the root of disease, and especially plant-based nutrition, which they don't emphasize as strongly as I think they need to. So what we do, we go right to the students. We get the name of the leader of the local LMIC there. We contact her or him. We say, how would you like a lecture by Dr. Klaper showing you the science behind how a plant-based diet reverses these diseases? Because my lecture on mechanisms of disease reversal here's how a plant-based diet lowers high blood pressure. Here's how a plant-based diet reverses type 2 diabetes. So they understand the science, that this is not California woo-woo stuff. This is official physiology. So they feel confident when they leave to start recommending plant-based nutrition for their patients with some authority. And hopefully they'll do it in their own lives, and they'll
Right.
get the benefit of that as well. So we go right to the LMICs, and the students are so grateful. They are so open to this message that you can't unring the bell. Once they hear it, they see it. It changes what they see the next day in outpatient clinic. That overweight diabetic patient, now they understand why they are overweight and diabetic and what can be done about it. So it's an exciting time. But as I said, we're going right to the students, and they're very responsive. It gives me great hope to see their response.
That's just so smart that you're doing that. I mean, because you can't start arguing with, somebody who's been practicing medicine for 40 years. They're doing it the way they do it. And I personally am grateful for you doing this. I don't know if you know, but like I reversed my heart disease with a plant-based diet
Oh, is that a
because
word?
yeah, well, I say even my cardiologist says I reversed disease, but I still have that nasty LP little a and all
So
that
do I.
nonsense.
So do I.
Um, but yeah, I mean, you can't argue with it. I mean, I had a high calcium score. I had two kind of clogged up arteries, and now I'll show you my Cleveland Heart Lab panel. Just, everything that's in my control is in green except for my
Wow.
uh yeah, I know I'm holding something up for those who are just listening. Yeah, everything that's in my control is in green except for my a what is it, the ApoB?
ApoB.
That's
Yep.
a Yeah,
Right.
that's a little elevated. It's 115, it should be below 90. My
Right.
LP little a is so off the charts. I probably should be having a heart attack this second.
Oh,
But
Lauren, thank you. Can I take a minute to talk about this? This is so
please.
important, especially for the vegans who may already be watching your program here. That I used to feel, well, all you need to do is adopt a plant-based diet. Your arteries will magically clear up and everything will be fine. Vegans won't get clogged arteries. They won't get heart attacks. Well, 50 years of medical practice smartened me up on that and humbled me down quite a bit. It turns out that there is this molecule that our body makes called LP, lipoprotein A, LP little a, and it's genetically determined. The blueprints are in your genes in your liver, and it churns out this type of cholesterol that has a protein around it, lipoprotein A, that makes it a really aggressive molecule. It burrows into the walls of the arteries. It sets off inflammation, sets off blood clotting, fosters plaque formation. And I thought, why does your body make this stuff? It's a molecular assassin. Well, it turns out it's probably a holdover from our ancient caveman days, or cavewoman days, when if you got your leg bitten by a saber-toothed tiger, you want molecules in your blood that promote blood clotting. And inflammation is the first stage of healing. You want these molecules, and it got us through those ancient saber-toothed tiger days, and
Oh,
We were
and
hitting
we're the
each
ones who survived,
Yeah,
right? To
you had a
pass on these
survival benefit
genes.
back then, and when we're the old days, we're hitting each other with battle axes, whatever. You want to be able to clot your blood. So throughout history, it was a useful molecule. But now in the 21st century, it's working the opposite direction. It's setting us up for heart attacks and strokes. And vegans get it. I've got it. My LP little a is sky high. I've got some plaque in my arteries that I'm working to reverse. So even vegans, you can't be too cocky here. So what can you do is lower all the other particles in your blood that might be contributing to plaque formation. And that's where this other number, ApoB, comes in. These are the total number of particles in your blood that can contribute to plaque formation. You want that as low as possible. That does respond to diet. But it responds to statin drugs as well. And it's not a matter of if you've got high LP little a and you've got high ApoB, a course of statins till those plaques melt away is not a sign of defeat. It's a matter of dealing with your biology, whatever it takes. But to all the vegans or to everybody out there, get your LP little a checked and your ApoB number determined, and that'll give you a true estimate of your actual risk of getting a heart attack or a stroke. And I'm so proud of you for encountering that and then doing what you need to do to lower down all those other
Well,
numbers. And indeed,
thank you.
that's how you reverse the disease. So,
Thank you. I mean, so maybe I do need a statin. Dr. Greger just kind of laid it on me. He was not happy with me. But I mean, like, I have no inflammation in my body. I have all
that's
my other
important.
numbers too. That was the other thing. I have no oxidized LDL, no ADMA. What is it? HSCRP all low, LP, PLA2, all that kind of stuff, MPO. So no signs of inflammation from eating this way. But still, maybe I really do need to think about the statin because my LP, what is it? My LDL is 116 now, 113.
That's great. That's a great number, but lower is better. And maybe
Well,
even if you
I've
visualize,
been working on that for 11 years to get it that low, so I don't know if it's going any lower, to tell you the truth. I might
um,
need a statin, maybe. I don't know.
right, but maybe just for a year or two till your arteries
Okay.
clean out. People can visualize the health of their arteries if they get an ultrasound scan of their carotid arteries or a study, a CT angiogram. They inject a little dye in the
Uh-huh.
vein in your hand, and then take a CT scan as it's going through your arteries. They can see the contour of the arteries. If you don't have plaque built up there, great.
I don't
You're
have plaque in my carotid arteries. They
Great. Well, that's
looked.
a great sign, and maybe that's all you need to do, and that you don't actually need a statin. But if you've got plaque in your arteries and you're doing all these other things, a year or two on statins might save you a stroke there. So work with your cardiologist. Because you're vegan doesn't mean you're bulletproof here, and but get that cholesterol down as low as you can, and you're doing a great job doing that.
Well, I've been trying for 11 years, but
Yeah. Mentioning these inflammatory markers, HSCRP, myeloperoxidase,
yep.
phospholipase, these are enzymes in the body that are active when you've got active plaque building up and getting ready to soften. These numbers are up, but hers are way down. So it says she doesn't have a lot of actual plaque, and they're not getting ready to rupture that set off blood clots so there's a good chance that Lauren herself doesn't need the statins, but that's between her and her cardiologist. Um, Though asking a cardiologist if you need statins is like asking a barber if you need haircuts.
He was trying to put me on a statin before he even gave
I,
me all those
I
medical
bet he
tests.
would.
And this is the second one I've gone to. But anyway,
So
maybe I need to find a,
if your arteries are clear and your inflammatory markers are low, you probably don't need the statin. So
well,
Lauren probably doesn't need it. But if your markers are up and your plaques, your arteries show plaques, you probably should be on a statin for a year or two or three till you can melt those
yeah.
plaques away.
What about, how does that affect dementia? Like
Well,
if
that's a real issue. There's, the classic Alzheimer's dementia, but most of dementia these days is actually a vascular dementia where the tiny little blood vessels in the arteries clog up and you wind up killing off brain cells from lack of blood flow. And even true Alzheimer's where these tau proteins and amyloid proteins get deposited, there's still a huge vascular component. When you look at the arteries of Alzheimer's patients, they're thickened and shrunk down. So all the way around, Dr. Osler said, you're as old as your arteries. A person's as old as
yep.
your arteries. So as far and bad atherosclerotic blood vessel disease really raises your risk of dementia. So keep those arteries as open as you can. And that, again, comes down to a plant-based diet.
Keep eating your greens.
Mm-hmm.
Um,
Keep eating everything.
okay. I have a couple quick questions
Sure.
from listeners. When somebody wants to know, is coloring your hair cancer causing? She had follicular lymphoma years ago, but she still wants to color her hair. Yeah, no.
Wow, interesting question. We live in a sea of carcinogens, from diesel exhaust and asphalt particles and pesticides and glyphosate and all this stuff and in the meats and the hormones. It's a carcinogenic the existence we're living here. And we all have our individual resistance. Not everybody gets cancer all the time. Most people don't get cancer. So but the earth as we've created it at this point is not friendly to our health, including our cancer risk. So she got a follicular lymphoma. Did it have anything to? Does it have anything to do with hair dye? It may well be a virus. In fact, there are poultry viruses, chicken viruses that seem to promote lymphoma growth. And so she may have gotten her lymphoma from what she was eating, the contaminants, etc. That hopefully has been cleared. That now she wants to color her hair. Does the hair dye the increased risk of lymphoma? If I were her, I wouldn't press my luck, at this point. When it comes to carcinogens, less is more. And so I can't say it's a one to, oh, yes, hair dye causes lymphoma. No one knows that. But it's one more one more straw on the carcinogenic camel's back, if you will. Why,
Yeah,
why, why put that on them? There's probably now non-toxic vegetable-based
right.
dyes that
There
you
are.
use. I would stay away from the peroxides and the oxidizing agents if I were her.
So maybe the non-toxic ones might be okay.
Yeah, make an effort to ask ChatGPT about non-toxic
Okay.
hair dyes. You'll probably find it knows everything else.
Okay. What do you think about these? I don't know if it's pronounced NAD or NAD plus supplements. What
Yeah, I'm a little
what do you?
skeptical. These are
That's
mitochondrial additives, like adding these to your gas tank. These additives that make the gas burn hotter. Um,
they're supposed to keep you young, but it works on your like cells, right? Isn't it? Which makes me nervous. It's like if it's boosting up your good cells, can't it boost up your bad cells?
Oh, Lauren, you are so wise in that observation. As we say in biology, in any complex system, from the Amazon rainforest to your own body, where nature's doing her complex things, the adage is you can't do one thing. You can't do just one thing. We find it in medicine. I'm giving this child an antibiotic to clear his ear infection. Well, that's what you think you're doing, doctor, but you're also killing off the bacteria in the child's gut, which is going to make the gut more leaky, which is going to allow food proteins to leak into the bloodstream, set off immunity. Everything sets off cascades of reactions. So to say, oh, I'm taking this NAD to fix my mitochondria, I'm taking this calcium to make my bones stronger. Well, that's what you think you're doing, but biology is so complex that you may well be setting off change of reaction, which, as Laura says, how do you know you're not feeding cancer cells? How do you know you're not spawning mutations in your nerve cell? How do you know? Because nobody's done, the only way to know is to give people these supplements, whatever, and follow them for 20 or 30 years, see what happens to them. Does it increase their risk of death, of brain tumors, whatever? And you need to know this, but no one's going to do those studies. Nutrition studies are so difficult to do. You'd have to take 1,000 people, put them all on the same diet every day for 30 years. Half you give the NAD, half you give a placebo NAD, and follow them for 30 years and see who's still. No one's going to do that study. People
Yeah.
change what they eat all the time. They travel, they have stress. You can't get two comparable populations. And so we don't really know the effect of these. There's a lot of marketing, but just because it sounds like a good idea on the ad doesn't mean it's a smart thing to do to your body. So get your NAD boosters from green vegetables and fruits and all the wonderful foods in a plant-based diet. Let your body take a walk every day, get enough sleep, get enough love in your life, laugh a lot. That's how you boost your NAD rather than taking it orally.
That's good. Well, thank you, Dr. Klaper. You're just so I could talk to you forever, and I do have a ton more questions. We'll have to have you back.
Have me back. I'd love to do
We'll
a
have
few.
you back. But
Yeah,
yes, everybody go check out movingmedforward.org and read this book. It really is eye-opening. If you want to know why your doctor doesn't know about nutrition, this is going to tell you why. And we didn't even cover the insurance companies, which, I thought that they would be on board with this, but
you
no,
would
you cover
think,
why they're not.
you would
So
think
yeah,
that they're making
it's
money off disease just like the rest of the
everybody else. Everybody
complex,
is.
everybody else,
What
right?
one question? This is
Uh,
what my last question. I don't think I asked you this before. I ask everybody, do you have a favorite health or beauty product? What do you do? You're just 70, 78 years old. Is that right?
I'm the turning
Gorgeous.
79 in July, right?
Wow.
Do I have a health or beauty Um, no, I don't. I'm just embracing the changes that are happening in my body. I've got a bottle of moisturizing lotion that I put on my hand, the skin of my hands and on my face every other night. That's about it. That's get
That's
enough
it.
sleep
Okay.
is the best by far. The best
Sleep.
beautifying thing you can do. Get enough sleep, drink enough water, eat a bunch of raw foods, have a big salad every day, get out in the sunshine, laugh a lot, get as much love into your life as you can, and you'll stay beautiful on the inside. That's all that matters.
Oh, thank you. Thank you, Dr. Clapper. You take care.
Thank you.
Bye-bye.
All the best to you and your viewers. Thanks for the interview.
Bye-bye.
Bye bye.
Thanks for listening, friend. From my heart to yours, be well until we meet again.